Welding fume consists of a mixture of particles, vapours and gases that are released into the air surrounding an active welding arc operation. The exact content of this mixture varies depending on the type of welding, the parent metals involved, including coatings, the welding rods used and any support gases required. The welding process releases a cocktail of heated fine metal particles, organic vapours, ozone and gases that rise into the breathing zone of the welder and others close by. This mixture can be breathed into the lungs and has the potential to cause adverse health effects if exposures are significant. Importantly, whilst the risk posed by welding fume is serious, keeping yourself safe can be straightforward. In this module, we look at the dangers posed by welding fume so that we can understand the risk associated with not wearing respiratory protection. We then look at what level of protection is required by law and what must be done if you're unsure of the level of fume exposures at your workplace. Finally, we take a look at what level of protection a welding helmet with integrated powered air respiratory protection can offer. In 2017, the International Agency for Research on Cancer reclassified welding fume as carcinogenic to humans, or in other words, they determined that there is a known link between welding fume exposure and the development of cancer. This reclassification confirmed what was already known. Exposure to welding fume is extremely bad for health and workplaces must protect their workers. Excessive exposure to welding fume has been linked with multiple types of cancer, including lung, larynx and urinary tract cancers. Welders present, on average, a 43% increased risk of lung cancer when compared with those who have never welded or been exposed to welding fume. This increased risk of lung cancer is regardless of the type of steel welded, the welding process, and independent of exposure to smoking. Aside from cancer, welding fume can also cause serious long-term health effects like lung function abnormalities, including bronchial asthma, chronic obstructive pulmonary disease, COPD, pneumoconiosis and other pulmonary fibrosis, as well as stomach ulcers, kidney damage and nervous system damage. Excessive welding fume exposure is serious. As a result, in September 2023, Safe Work Australia voted to immediately lower the workplace exposure standard for welding fume from 5 milligrams per cubic metre of air to 1 milligram per cubic metre of air. In January 2024, Work Health and Safety Ministers around the country endorsed the decision to change legislation in Australia. All Australian workplaces must now comply to the new lower limit by law, and the change in Australia sends a clear message to other countries. The new workplace exposure standard in Australia simply means that the average airborne concentration of welding fume inhaled by a worker when calculated over an 8-hour working day over a 5-day working week must not exceed 1 milligram of welding fume per cubic metre of air. This limit applies to welders and those who work around welders. This is not optional, this is the law, which will be enforced by health and safety regulators. There are also specific exposure standards for chemicals that can be commonly found in welding fume, such as manganese, cadmium and chromium. Hardening agents found in metals, coatings, welding rods, alloys, filler materials and plated materials can include toxic chemicals that have extremely low exposure limits and can lead to very serious health effects. If employers or employees are unsure whether the welding fume exposures at their workplace exceed the exposure standard for welding fume or exceed the exposure standard for specific contaminants, welding fume monitoring must be conducted. It is important to understand the exposure standards in Australia and New Zealand do not identify a dividing line between a healthy or unhealthy working environment. They simply establish a legal maximum upper limit. Exposure limits are just the beginning, and workplaces should look to roll out a combination of controls to give welders the best possible protection. Respiratory protective equipment can be one control used to reduce your exposure to welding fume and other chemicals found within fume. Welding helmets with integrated powered air purifying respirators are the most widely used form of respiratory protection amongst welders in Australia and New Zealand and are now mandatory within many businesses. They have a required minimum protection factor, RMPF, of 50, meaning that a PAPR can supply you with breathing air at least 50 times cleaner than the air you would breathe if you were unprotected. As a result, PAPRs can not only take your exposure to welding fume below the legal limit, but potentially much lower, giving welders the protection they deserve. Using a PAPR in the work area whenever there is a risk of significant welding fume or ozone exposure can provide highly effective protection.